Fat, coffee and alcohol are reduced if you have gastrointestinal problems. Excess gastric acid is not just a problem causing mild burns. It often leads to more serious problems, such as acid reflux disease and stomach ulcers. Fatty foods are hard to digest, so they stay in your stomach longer than other foods, and your stomach produces more acid as the food is in the stomach. Urine for a long time. Highly fatty foods include chicken skin and Western foods. Caffeine. Caffeine promotes excessive stomach acid production. The University of Maryland has advised you to abstain from caffeine-rich beverages, including coffee and soda carbonate. Alcohol. Alcohol is a risk factor for excessive acid output. Beer can double your acid in your stomach within an hour. Also, excessive alcohol consumption can irritate the lining of the stomach and cause stomach inflammation. Five points you make the life of depressed individuals. People around you with depression may be the one who inspires you to think less and can save lives. In particular, one of your cautious words can make a life lost. So below, we will show you ways to help depressed people with hope. What's going on? First, when you see a friend, as someone with an unusual condition, you should dare ask them what's going on. You should encourage him and make him aware that you can be a fan of his stories. After they agree, you should completely relax your feelings, then ask them questions by asking a good question. You can ask them to tell you things more clearly, so you do not have to ask questions that are more disruptive to them. Then listen carefully and concentrate on them. Listening carefully can make him speak out with all his heart. Do not keep them in mind, and there is no place to relax. After they talk, you can remotely solve their problems, whether they are having problems with the clearness and accuracy. Finally, you can give them your ideas, but providing a good idea does not hurt him to think short. You should make them aware that problems can be solved, and life is valuable, not waste. So you should talk to them until they understand the value of life, and understand that their problems can be solved so they have the hope of living. Urinary tract infections can be prevented, and if you There are many ways you can do this to prevent urinary tract infections. After the urination, women should wipe back and forth with a condom. After a bowel movement, be sure to wipe the front and back to avoid bacterial infections from the rectum into the urinary tract. Another thing that both boys and girls can do to prevent urinary tract infections are persistent urination. Avoid long-term protection. Men and women should keep their genitals clean and dry. Girls should change their hygienic habits frequently during their periods. Frequent soaking can cause inflammation to the area of the vagina, so women should bathe or soak with normal water. Nylon coat wear is beneficial. And girls should skip the use of some body fluids because this product can sometimes cause infection in the urinary tract. If you are sexually active, go to the bowel before and during 25 minutes after having sex. After sex, gently wash the penis to get rid of the bacteria. Avoid sexual contact that affects the urinary tract or bladder. Finally, drink plenty of fluids a day to keep the bladder working and get rid of bacteria. Remember, even though urinary tract infections are uncomfortable and often make you sick, it's common, and it's easy to cure. The longer you spend with the doctor, the easier it will be. Swollen feet during pregnancy. These protection tips are very effective. Problems with the swelling of the feet during pregnancy have many different contributing factors, causing women to swallow ankles and ankles during pregnancy. At first, women have more fluid flushing during pregnancy. Also, the increasingly energetic womb also clings to the arteries that return to the heart. This can cause swelling of the feet and ankles. Hormonal changes can also play a role. Swelling of the feet and ankles during pregnancy is a common occurrence and usually goes away after giving birth. At this stage, there are some ways to help you. Avoid standing for long periods of time. When you can sit, lift your feet high and rotate it left and right. It gets better when you sleep. You should be on your feet. Sleep tail. If possible, sleep to the left. This can lower the pressure of the largest artery. Slightly tighten your socks. Your doctor may recommend tight socks during the day. Exercise regularly. Regularly walk, bike or swim. Standing or walking in the swimming pool. Despite little research on the use of water pressure for swelling of the feet and ankles, walking in the tank seems to help to hold the legs on the legs and help temporary swelling of the feet during pregnancy. It can also help to keep ice in place of swelling. Some research has suggested that foot massage may help relieve the swelling of ankles and legs during pregnancy. Also, swelling of the leg does not mean you should cut down on drinking water. The Institute of Medicine recommends drinking 10 glasses of water per day during pregnancy. Although swelling of the feet during pregnancy is normal, but swelling up quickly and painfully, especially if it is on the legs, may be a sign of deep vein thrombosis. Sudden hypertension may also mean higher blood pressure, which can be a sign of preeclampsia. Both conditions require timely evaluation and treatment.